I think the paradigm in medicine is really changing. The payers have certainly told those of us that provide health care that they can no longer afford the cost of health care.
In the US, we spend twice as much per capita as other industrialized nations on healthcare, with no significant difference in outcomes. We also have the opportunity to reduce those costs by almost 30%. The challenge here is not access to healthcare, it's access to healthcare at an affordable price.
I think in this market, you got to be agile. You've got to think of how do you cut your costs and how do you provide the highest quality outcome at that reduced cost and do it on a repetitive nature. I operate for a living, and I can honestly tell you, I never once asked the question, what did whatever I just opened up cost? That would never have occurred to me.
Healthcare systems are trying to tackle costs in a few ways: supply chain efficiency, process redesign, and then optimizing surgical procedures. Ethicon has expertise in various surgical procedures that are high volume, impacts lots of patient lives, and ultimately how hospitals are reimbursed.
At Johnson & Johnson and Ethicon, we are working hard to develop a suite of solutions specifically designed to help hospital systems meet their triple aim goals. Some of these programs include infection prevention efforts, SKU rationalization, inventory management, shared decision-making tools, and a specific area of need around procedure standardization with our new Optimize program.
Optimize is a modular surgical program that reduces variation in protocol, technique, and product utilization. Data analytic tools are used to quantify this clinical and economic variation. The key, though, is the implementation plan that's based on these data insights that really helps providers drive and make decisions around improvement in surgical approach, outcomes, as well as address supply costs. No surgeon or clinical team is going to change the way they deliver care to a patient without data and evidence.
I think the big thing that Ethicon brings to the table is a legitimacy of somebody that's been in the marketplace for a long time. They understand where the future of healthcare is, and they're trying to figure out what role they play as a corporation in getting us all to that.
Our ultimate goal is to help progressive hospital systems accelerate how they implement change and win in the face of healthcare reform.
Could we do this alone? No. Could Ethicon do this alone? No. And I think both parties recognize, which is why the partnership works.